Okay, so imagine this. Your arm suddenly feels weak, kind of numb, and it's got this intense, nagging pain. You go to the doctor, maybe even a few doctors, but nobody can seem to nail down what's wrong. This isn't just some made-up scenario. It's the reality for a lot of people dealing with something called brachial plexopathy, and it is a true medical mystery. And that's what we're going to dig into right now.
Now you might think, oh, it's just a pinched nerve, right? But here's the thing. The symptoms, they don't quite fit. They're kind of all over the place, they're confusing, and they point to a problem that's much deeper, much more complex, right at the very root of your limb's entire nerve supply. And that's because figuring out a plexopathy is like trying to solve a really intricate puzzle. It's not as simple as, say, x-raying a broken bone. Doctors have to become detectives here, piecing together all these little clues from a patient's story, a really careful physical exam, and, of course, some of the most advanced medical tech we have today.
And look, that's not just me saying it. As Dr. Rocio Vasquez do Campo, a top neurologist, points out, these disorders are, well, they're notoriously tricky. The symptoms can easily look like a whole bunch of other more common things, like a pinched nerve in your neck or a simple shoulder injury.
You see, the real reason it's such a puzzle is that the weakness and the sensory loss, they're often described as diffuse and patchy. What that means is they don't follow the neat little map of a single nerve. So you might have weakness in your shoulder and your hand, but your elbow is totally fine. That kind of confusing pattern, that's the classic sign that tells a doctor they're probably dealing with a plexopathy. So what in the world is this mysterious structure that's causing all this trouble? All right, let's get into it. The best way to think about a plexus is to picture the main circuit boards for your arms and your legs.
A plexus is this dense, tangled network where all the nerve roots coming out of your spine merge together, they shuffle around, and then they branch out again to become the major nerves running down your limbs. It's kind of like a massive highway interchange for electrical signals. It routes all the messages for movement and sensation to very specific places. So you can imagine, if there's a problem there, a traffic jam, it's going to affect multiple routes all the way downstream.
For your arm, we're talking about the brachial plexus. And what's really fascinating here is just how organized this circuit board is. The upper part, or the upper trunk, is what lets you lift your arm out to the side. The middle trunk, that's in charge of straightening your elbow and wrist. And the lower trunk is absolutely crucial for all the fine, detailed movements of your hand and fingers. So if you damage just one of those trunks, it creates a very specific, very predictable pattern of weakness.
And it's the exact same idea for the leg with the lumbosacral plexus. The upper part lets you do things like flex your hip and straighten your knee. The lower part takes care of all the really complex movements in your ankle and your foot. And it even handles incredibly important functions like sphincter control. Just like in the arm, an injury here creates a pattern of problems that a good doctor can trace right back to the source. So what can actually go wrong with these critical junction boxes? Let's take a look at the usual suspects, the things that cause plexopathy. And they really fall into two big categories.
On one side, you've got the traumatic causes. These are the sudden, really forceful injuries. We're talking high-speed car accidents, gunshot wounds, or even something that sounds pretty minor, like carrying a super heavy backpack for a long time. That can actually cause a condition called rucksack palsy. Then, on the other side, you have the non-traumatic causes. These are usually slower, sneakier processes. Things like a tumor growing and pressing on the nerves, or inflammation, or even damage from something like radiation therapy or diabetes.
But let's be clear. When we're talking about the brachial plexus in the arm, trauma is the big one. It's the cause in about 90% of cases. Things like motorcycle accidents are an especially common cause. And you can see why. A crash can forcefully stretch the neck and shoulder apart, violently yanking on that whole bundle of nerves and causing just catastrophic damage.
Okay, so to solve this incredibly complex puzzle, clinicians need a pretty high-tech detective kit, and this is where modern medicine is just amazing. It combines that old-school detective work with these powerful new tools that let us see what's going on inside the body in incredible detail.
The whole diagnostic pathway is really logical. It always starts with a really thorough clinical exam and just listening carefully to the patient's story. Next up are electrical tests, like an EMG. You can think of it as kind of like an EKG for your muscles and nerves. It measures all the electrical activity to help pinpoint exactly where the damage is and how bad it is. And then, finally, doctors turn to advanced imaging to get a direct look at the nerves themselves.
And the two main imaging tools here are ultrasound and MRI, and they both have their own unique superpowers. Ultrasound, think of that as the dynamic scout. It's awesome for getting a live, real-time view of the nerves that are closer to the surface. You can even see how they move and if they're getting pinched. MRI, though, that's the gold standard. Its incredible detail lets doctors see everything: the deep structures, the spinal roots, and even tiny changes in muscles that tell you a nerve isn't working right. And very often, they're used together to get the complete picture.
But here's the thing. Imaging does way more than just find the injury. It actually helps doctors grade how severe it is, which is absolutely vital for figuring out the best treatment. Not all nerve injuries are created equal, not by a long shot.
And this table right here, this just brilliantly shows how what a radiologist sees on an MRI scan translates directly into a patient's future. So a mild grade 1 injury, that's basically like a bruised nerve. The MRI might just show a little swelling and it's probably going to heal all on its own. But a severe grade V injury, that's when the nerve is completely cut in two. The MRI shows a clear break. There is zero chance of it healing by itself. This patient is going to need complex surgery, maybe a nerve graft, to have any hope of getting function back. So you see, this is why precise imaging is so incredibly critical. It can be the difference between a full recovery and a lifelong disability.
So, after all of that detective work, the exam, the electrical studies, the advanced imaging, we can finally solve the plexopathy case. And that isn't just a medical victory. For patients, it's a lifeline. It's moving from confusion and fear to having a clear diagnosis and a path forward.
All right, so let's quickly recap the most important points. First, plexopathy is a really complex nerve injury, and it's tough to diagnose. Second, just remember to think of those plexuses as the body's main circuit boards for the arms and legs. Third, the causes can be anything from a sudden accident to a slower disease like cancer. Fourth, ultrasound and MRI are the essential detective tools for actually seeing the injury. And finally, and this is the big one, getting that precise diagnosis is everything. It's the key that unlocks the right treatment, whether that's physical therapy or complex nerve surgery.
And all this brings us to a final, really exciting thought. You know, as our imaging technology gets sharper and sharper, and as artificial intelligence gets better at helping us read these complex scans, are we getting close to a new frontier? A future where we move beyond just diagnosing these devastating injuries, and maybe, just maybe, start to truly reverse them.